Normal nightfall. This occurs naturally when the body releases excess reproductive fluid during sleep. It is most common during teenage years and early adulthood, when hormonal activity is at its peak. As the body develops, it produces this fluid regularly, and if it is not released during waking hours, it may be released during sleep. This is simply part of the body's natural regulation system. It usually happens occasionally and does not harm the body in any way. Many people experience it without even realizing it at first. Over time, as hormones stabilize and the body matures, the frequency often decreases on its own. It is generally considered a normal biological process and does not require any treatment unless it becomes unusually frequent or causes discomfort. Frequent nightfall. In this type, nightfall happens more often than expected, sometimes several times within a week. This can feel concerning, especially if a person is not aware of how common it can be during certain phases of life. Frequent nightfall is often linked to temporary hormonal imbalance, mental stimulation, or lifestyle patterns such as lack of physical activity. In many cases, it is not a permanent issue. The body is simply adjusting its internal balance. However, if it continues for a long time, it may lead to feelings of tiredness or mental stress. Improving daily routine, getting proper sleep, and maintaining a balanced lifestyle usually helps bring it under control naturally. Nightfall with erotic dreams. This happens when nightfall is accompanied by vivid or emotionally intense dreams. These dreams are often influenced by thoughts, experiences, or imaginations stored in the mind during waking hours. During sleep, especially in deeper stages, the brain becomes active and processes these thoughts, sometimes creating detailed dream scenarios. As a result, the body may respond physically, leading to nightfall. This type is very common and reflects how closely the mind and body are connected. It is not something unusual or unhealthy. In fact, it shows that the brain is actively processing emotions and memories, which is a normal function of sleep. Nightfall without dreams. In this case, nightfall occurs without any remembered dream or mental image. A person may wake up and notice it without recalling anything unusual from their sleep. This can feel confusing at first, but it is completely normal. Not all sleep stages involve conscious dreaming that can be remembered. Sometimes the body responds physically during deep sleep phases where the mind is not actively forming clear dreams. This type highlights how the body can function independently of conscious thought. It is harmless and does not indicate any underlying issue. Stress-induced nightfall. Mental stress and emotional pressure can have a strong effect on the body, even during sleep. When a person is dealing with anxiety, overthinking, or emotional tension, the brain remains more active than usual. This can disturb sleep patterns and lead to irregular responses from the body. Nightfall may become more frequent in such situations. It is not directly caused by a physical issue, but rather by the mental state. Once stress levels are reduced and the mind becomes more relaxed, sleep quality improves, and this type of nightfall often decreases naturally. Diet-related nightfall. Food habits can influence how the body behaves, especially at night. Eating very heavy meals, spicy foods, or eating late can disturb digestion and affect sleep quality. When the body is not fully relaxed during sleep, it may respond in different ways, including increased chances of nightfall. Although diet is not a direct cause, it can act as a contributing factor. Maintaining a balanced diet, avoiding heavy meals before sleep, and keeping regular eating habits can help create a more stable internal environment, reducing such occurrences. Weakness-associated nightfall. Some individuals feel tired, weak, or low on energy after experiencing nightfall frequently. In most cases, this feeling is not due to actual physical loss, but is connected to mental perception, poor sleep, or lack of proper nutrition. When the body is already not well rested, any disturbance during sleep can make a person feel more exhausted. This type often improves when overall health is managed properly. Getting enough sleep, eating nutritious food, and reducing stress can make a noticeable difference in how the body feels. Medical condition nightfall. In rare situations, frequent nightfall may be linked to underlying medical conditions such as infections, irritation, or hormonal imbalance. This type is usually accompanied by other signs like discomfort, pain, or unusual symptoms. Unlike normal nightfall, it may not reduce on its own and can persist over time. In such cases, it becomes important to seek medical advice. Early attention helps identify the root cause and ensures proper care. While it is uncommon, being aware of this type helps in understanding when professional guidance is needed. Habit-linked nightfall. Daily habits play an important role in how the body functions. Irregular sleep schedules, excessive use of screens before bed, lack of physical activity, and inconsistent routines can disturb the body's natural rhythm. When this rhythm is disrupted, the chances of nightfall may increase. The body responds best to consistency. Creating a healthy routine, reducing screen exposure at night, and staying physically active can help regulate sleep patterns and reduce such occurrences over time. Age-related nightfall. Nightfall is strongly connected to age and hormonal development. It is most common during teenage years and early adulthood when the body is going through rapid changes. During this time, hormone levels are higher, which increases the likelihood of such experiences. As a person grows older and the body becomes more stable, the frequency usually decreases naturally. This type shows how nightfall is often just a phase of development rather than a lifelong condition. Psychological nightfall. The human mind has a powerful influence on the body. Thoughts, imagination, and emotional focus during the day can carry into sleep. When the mind is deeply engaged with certain ideas or feelings, it may continue processing them at night. This can lead to nightfall as a physical response to mental activity. It highlights the strong connection between mental state and physical reactions. Managing thoughts, staying mentally balanced, and avoiding overstimulation can help reduce this type. Irregular sleep cycle nightfall. Sleep timing plays a crucial role in maintaining the body's balance. When a person sleeps at different times every day or does not get enough rest, the internal body clock becomes disturbed. This imbalance affects how the body behaves during sleep. As a result, nightfall may occur more frequently. Establishing a consistent sleep routine, going to bed at the same time, and ensuring proper rest can help stabilize the body's natural cycle and reduce this type over time.